I'm Dr. Megan Shannon. I'm a urogynecologist here at Virginia Women's Center. There are different types of urinary issues. Some women complain that they leak urine when they may sneeze or laugh or cough or jump on the trampoline with their kids. And then some women may talk about how they feel like they're going to the bathroom constantly, frequently, urgently. Some women even may get minimal warning and all of a sudden start leaking a very large amount of fluid on their way to the bathroom. So we will talk together about which of those problems you're having because they do have different treatments usually. To start talking about the issue where a woman leaks when she coughs or sneezes or laughs, that's called stress urinary incontinence, and there's several options for management of this. The most conservative option is called pelvic floor physical therapy, and that's where a lady physical therapist teaches you how to coordinate your muscles of the pelvic floor, especially around the urethra. Essentially, the urethra is bouncing when you're doing those things and squirting a little bit of urine out. 70% of women who go to physical therapy find some improvement in their symptoms. That's not for everyone. Some women like to use what's called an incontinence pessary, and I have an example of that here. And it's essentially a little ring that has a knob on it, and a woman can manage this herself. It sits in the vagina. She doesn't feel it. No one knows it's there but her. She may wear it all the time. She may just wear it when she goes to the gym, but essentially the urethra, when it's bouncing, it can only bounce so far because it hits this little knob. Okay, and then some women prefer a more definitive therapy such as surgery, and there's a sling surgery that I can perform. It takes about an hour. You can go home the same day, and that is also effective for this problem. Then there's the issue of the overactive bladder, either the going all the time or the leaking with minimal warning. And so for this, we start to talk about healthy bladder habits because for a lot of women, they may just not be practicing healthy bladder habits. So we talk about the proper number of times a day to void, to empty your bladder. We talk about the healthy amount of fluid to drink and what fluids can actually irritate the bladder lining and make you need to go more frequently. And then after that, physical therapy is highly effective for this, helping a woman retrain those pelvic floor muscles so that when she feels an urge, she's able to contract the muscles and defer that urge. There's also medications that can help with this problem. And when all of those things fail, the changes in your habits, maybe physical therapy, maybe medication, there are some third line treatments. And this may include putting Botox in the bladder here in the office. It just takes a few minutes. Or some procedures with the words called sacral neuromodulation, which is kind of like a pacemaker for the bladder, or there's something called percutaneous tibial nerve stimulation, which I kind of like to think of as a little acupuncture needle to the ankle every week for 12 weeks, and that can help as well.